Hi, welcome to It Takes Guts. I am your host, Stacy. I have been a gastroenterology nurse practitioner for the past 6 years, and prior to that, I worked as a nurse in the endoscopy department for 15 years. I love GI. Today's subject, I think, is kind of fascinating, and I wanted to touch on it. It's called FMT, Fecal Microbiota Transplant. It's poop, stool transplant, fecal transplant, the little poop pills, all of that. It's encompassed under FMT. Why in the world would you need a fecal transplant? To answer that, we need to talk about some of the benefits of our gut. One specific thing is the bacteria that it houses. It's estimated that a human gut has 100 trillion bacteria living in it, most in the colon. We have at least 1,000 different types of bacteria, it's estimated. So these bacteria, there are some that are not helpful, but there are a lot that are. Some of the roles that they play is they help us synthesize vitamins. They help us metabolize bile. We know that they help somehow with our immune system, which is crazy important. We don't know exactly how, but we know it plays a role in our immune system. And the healthy bacteria helps prevent the bad bacteria from colonizing in our colon and causing sickness. Every once in a while, it gets out of whack and the healthy beneficial bacteria get knocked out, and it leaves room for the harmful bacteria to colonize and kind of take over the colon and get people really sick. There's one specific infection called Clostridium difficile, or C. diff. It's a bacteria that we all have in our colon, but again, the healthy bacteria usually helps keep it at bay. However, when we're given antibiotics to treat infections, a lot of them are not just treating that one infection, that one type of bacteria. It can affect the bacteria in our colon also. So while, yes, we need antibiotics sometimes when you have pneumonia or a skin infection, sometimes those antibiotics can affect the colon and really cause an imbalance in the bacteria, allowing the bad bacteria to take over. When this happens, people can get really sick. C. diff usually it does cause pretty significant diarrhea. It can sometimes cause bloody diarrhea, abdominal pain. Some people can end up with it spreading throughout their body. They can get septic and end up in the hospital. Most of the time, it does not get that far. Most of the time, people are so miserable with the diarrhea, they come in to see their doctor to say, "What is going on? Please help me." We find out what it is. Most of the time, we have 2 specific antibiotics we can treat this infection with. But every once in a while, the infection does not get knocked out by these antibiotics. And if you've been treated at least 2 to 3 times and it's not going away, or it keeps coming back, then you could be a candidate for a fecal transplant. Where would you get the stool for a fecal transplant? Yes, there are stool donors. Most places now, we get them through specific companies that are safe. They screen the donors, and it comes already prepared in a package. Prior to having that available, I remember when I worked in the endoscopy department, if we had somebody who had a C. diff infection and needed a fecal transplant, they often would have a family be a donor. Well, how would you know which donor? Well, somebody who's healthy. Because the goal is you are instilling healthy stool, which has all the right healthy bacteria to get back in there and knock out the infection and get everything back in balance. So you want somebody who is healthy, somebody who does not have any infections that you could contract from the stool. So again, most of the companies that are being used, which is standard, they do screening. They're looking for E. coli or hepatitis or anything that would be a concern. And so the risks of contracting something are pretty low. So how do you get it administered to you? There are a couple different ways. The newest one is the capsules. And they're not just like one capsule, but what it is they come to you usually in a frozen, and you get them to room temperature. And it's a number of capsules that actually have stool in them. And you take them and swallow them with a lot of water and make sure they get down. They open up further down in the GI tract. And then you're instilling this healthy bacteria that helps get that microbiome back in balance to help you fight this infection. Another way is sometimes if people are sick and in the hospital, they can do it through a nasogastric or nasoduodenal tube, which is a tube that goes from your nose all the way down your stomach and into the upper portion of your small intestine, and they can administer it that way. The other way is during a colonoscopy. And so you'd get sedated, and then we would insert the scope. And when the scope gets to the far reaches of your colon, which is called the cecum, so that's at the far end of the colon, right before it gets to the small intestine, that's where we would instill the transplant, the stool material. That way it's able to essentially kind of coat the entire colon as it's coming out, which I know sounds kind of gross to probably most people. It does not to me, but it's brilliant to think that, wow, we know we have these people who have a healthy gut flora. So we know we need to give it to somebody whose is really messed up. And it's very beneficial. It's 94 to 99% effective. People respond really well. There's been studies that one time is effective, and a few people who didn't respond the second time completely responded. So it does work. When do you think you might need one? So really, unless you have a C. diff infection that's not responding to antibiotics, you don't need to go look for this. I know there's been some stuff out there on the internet on, well, maybe for irritable bowel syndrome, if I just, get some healthy stool instilled in me and healthy bacteria, that's not really, hasn't been shown scientifically yet to be the thing. There are some over-the-counter probiotics that some people can use, but again, we don't always know the best one or what the level should be. But really for a fecal transplant, it's specifically for this infection. So if you are seeing this and you're like, man, I have had the worst diarrhea and abdominal pain, and sure enough, it started after those antibiotics and it's not going away, talk with your primary care provider. Go see your gastro doctor or nurse practitioner. We can actually do a test on your stool to see if you have this infection. If you have had this infection and you've been treated and you are just not getting better, you definitely want to talk to your GI provider. And then this would be something we would consider for you. I hope that this has been something entertaining and educational for most of you. Please leave me some comments, like and subscribe to the channel. Let me know if there are some other topics you definitely want to hear about or that you're interested in. And remember, I would like for you to stay educated, informed, and know that you're not alone.